Over the last month, the FDA has told women and doctors to stop using bioidentical hormones to treat the symptoms of menopause and stick with approved drugs. One specifically is called estriol. Dr. Elizabeth Vaughan is here this morning to explain the issue. Good morning.
Good morning. How are you, Cindy?
I'm doing good. All right, first of all, tell us what estriol is and why you disagree with the FDA's decision.
Doesn't the FDA have enough to do without attacking compounding pharmacists filing prescriptions written by physicians for the safest estrogen women can take? Estriol is the most plentiful estrogen in women's body. This is a full-page ad in the New York Times from January 11th responding to this consumer report from the FDA, which just blasts estriol. The article in the New York Times was authored by Dr. Jonathan Wright, who is the father of bioidentical hormones in America.
So why is the FDA taking issue with estriol?
Well, you know, who knows sometimes? Politics, power, money. Estriol acts as an anti-estrogen when combined with estradiol, the more common estrogen that we hear about. It's a stronger estrogen. Women who have higher levels of estriol earlier in life have a lower risk of breast cancer later on. Also, women with higher levels of estriol live longer after treatment for breast cancer. You know, I test to make certain that women are making enough estriol whenever I give them hormone replacement therapy. And if they don't have enough of the estriol on board, I adjust their hormones. Okay. Some physicians actually call estriol the anti-cancer estrogen.
Well, there you go. Well, the FDA did something also, though. It sent letters to compounding pharmacies across the country telling them not to use estriol.
I know, and I called a compounding pharmacist last night and found out estriol is still alive and well, but you may need to contact your congressman or senator to make certain it's still available for you. Physicians who have been trained in prescribing bioidentical hormones should be able to treat patients who need and or want them. Some prescription drugs, like Vivel Dot or Divigel, contain a bioidentical estrogen, estradiol. It's the stronger one. This is fine for many women, but each woman is unique. Some women don't tolerate the stronger estrogen. Some don't break it down correctly into estriol. And some are just worried that they may get cancer and they want to use the absolute weakest estrogen they can, and that's going to be estriol.
Every woman is different.
That's exactly right. So if you or someone you love uses bioidentical hormones, or you just don't like the government getting in between you and your doctor, check out the American Association for Health Freedom that supports the patient's right to choose and the physician's right to practice at www.healthfreedom.net. Also check out Hands Off My Estrogen at www.home, for Hands Off My Estrogen, homecoalition.org.
And there's also a link at naturaltriad.com. We've put all this on the morning news page of our website, myfoxwghp.com. You can stick around because just a few minutes we're going to open up your turn lines and you can talk to Dr. Vaughan and ask her any questions you may have.